Hi, I'm Freya. I'm a student ambassador at the University of Derby, and I'll be the questionnaire facilitator today. So I'm just going to ask some questions to the panel. So would you like to introduce yourselves and be able to sum up your role in about one sentence?
Would you like me to go first? I'm Jane Parsons. I'm a service manager of a charity called Chesterfield Care Group, and we provide day service support for older adults.
My name's Jonathan Davis, and I'm a community support worker for Chesterfield Care Group.
That's great, thank you. So kind of what does your role, so would you be able to sum up your role, you know, like what you do, maybe no more than like 3 minutes? Yeah, you can go. Yeah.
Well, my role as a service manager is that I answer to a board of trustees, but I am responsible for managing and running the service for day services. Currently, we are a little bit depleted because of COVID, but usually we have 9 services that are all quite different. So some may be a walking group, others may be a little gardening group, others are people who might have be a little bit further on the journey of dementia. So they're smaller groups out in the community with a high level of staff and providing sort of different kinds of activities. But my overall role is to ensure that it runs correctly, that all the health and safety procedures are there and in place, and that everybody's happy.
My role as a community support worker is to help the day service worker, which is a senior role to mine, run the day, help with activities and plan activities with them. We see the client in the morning. We probably sit them down in a seat, make them a cup of tea as an unusual rule. And then we'll spend a bit of time chatting to them, seeing what they've done in the last week or so. And then start our first activity of the day. Like Jane mentioned, we do lots of different activities like craft and singing, walking groups, or whatever the service user might like to do that day. We'll often ask them what they would like to do and what they might want to do in the future. Then we have a meal where we have a first course and a pudding, and we bring that to the service users, then take that away. And then we'll repeat the same in the afternoon, and then they'll get a bus and go home.
It's nice to hear about how varied it is as well, and I like the bit about the pudding as well. So so the next question, so start with you, Jane. So could you explain the term older adult care and explain who uses your service?
Yeah, I mean, technically, the older adult is somebody over 65 who is eligible for our service. Things are changing. We tend to see people who are way older than 65. Our age range currently is 65, and it was recently 103. But unfortunately, that lady passed away recently. But 103 is a ripe old age, and people are still using that service. And some people who use the service are well into their 80s, and they don't even see themselves as older people. And I think it's an individual thing, the word older adult for me, because for somebody myself who's in the mid 50s, and some services say that you can come into services when you're over 55, and I certainly don't feel like an older adult. So it depends what target group you see yourself as. That's the big thing. And yes, technically it's over 65, but for a lot of people that use our service, age is just a number. It's how you feel.
Just to follow up what Jane said, I think as we progress as a service, we are finding the clients like to do younger activities as such, and we've now got some tablets which some of them are really getting into and really enjoying at the moment, and doing younger things. We walk a lot more than we once did, and we're really evolving as a service at the moment, which we're trying to push. As Jane mentioned earlier, COVID had an effect on our service where the service users numbers are went well down from people isolating and people moving into different services or into care homes. So we're looking to provide much more modern activities now, I think, to involve a slightly younger feeling clientele, if not in age.
Yeah, so I suppose I understand that Chesterfield Care Group is a charity. So what other services exist for older adults that people might work in? Jane, do you know?
Sorry, nearly forgot to unmute myself. Yes, Chesterfield Care Group is a charity, but there are lots and lots of different services out there. If I just give a very quick background, Chesterfield Care Group hasn't always been a charity. It was run by Adult Social Care, which was then called Social Services, way back in the day. In 1996, it then went over to become a charity, and it's been run as a charity ever since, and it's our 25th anniversary this year. So we will be having a celebration when we can. But there's lots of different places where people, if they're looking for work in care, so there's care at home services, for example, where people live in their own home and people can go and support that individual in their own home. And that can be anything from assisting to get up in the morning, to go to bed at night, to make meals, to assist with shopping or outings. It depends what that individual wants. And that can be provided either through adult social care or through private agencies, or again through charities. So there's lots of different areas. Obviously there's nursing homes, there's places like that if people want to work in those settings. And look at us, I mean, we're a day service provider that's been going for 25 years, so there's still a need for day services. So there's lots of different services out there if people want to work in care.
I think to add on to what Jane said, a lot of our clients will have carers in the morning before they come to us, or perhaps do live in a care home. So other staff that work in those organisations really help us out. We also have community transport, so they obviously work with our clients as well. So they get to know them, they bring them to us. So it's kind of, without them, we wouldn't be able to function as well, because they get them ready or take them at the end of the day from when they've had a day with us. So like Jane said, that the care homes are very important, and the carers in the community are very important, because that helps our service run as well.
It's great to hear all the different types of services that people work in, a lot that I wouldn't even think of immediately. So it's great to hear that range. So I suppose the next question, it would be like, what career progressions might be available in the sector? Jonathan, do you want to answer this one first?
Within our company, we start as community support workers, and then in our own company, the next role up is a day service worker who has slightly more responsibility to run the day, and if there's any emergencies, to be the first on call for that. I know in other settings there's a lot of different roles and varied roles, and it's a big sector within care where you can find yourself a lot of different roles where you can progress and find different things you enjoy.
What about you, Jane? So kind of, what do you think about the career progression?
I think it's important for people to feel comfortable if they want to progress in their career, but also to feel comfortable knowing that they make a difference. That's the big thing for me. I've not always been a manager. I've been at Chesterfield Care Group for 11 years now, and I've had a very varied sort of progression career. I started a long time ago in 1984, and I actually started as a student at Tontine Road, which is where we're based, and I did a youth training scheme. So if anybody looks way back then, so there can be apprenticeships now, there can be college courses, there's all sorts of things. And as Jonathan said, you know, there's there's steps you can do, and I think it's about people really feel comfortable in that role. And some people may get up to day service worker and think, this is me, this is what I want to be, and that's fantastic, because they've still got a lot to offer in that role. Or, you know, you might be a little bit curious like myself and wanted to push the qualifications and do different things and move forward. But I've always loved what I do, and I think that's the big thing, is that it's great to progress in a career, but hold on to loving what you do, and that's a really good leveler, I think, in lots of ways. So yes, you can progress in any career, but if you love what you do, then it doesn't feel like a chore.
Yeah, it's great hearing the passion for it as well, because that's something you want, like, people would want to be happy as well in their career, and like finding a career that they're happy in. So I suppose the next question for you, Jonathan, would be kind of, what training have you done as part of your role?
We do a lot of different varied training. Jane's very good with finding different training courses for us. We do standard training such as moving and handling, fire safety, first aid, qualifications we need to do and keep doing. We have also done lots of different training, such as more dementia-based training or mindfulness training, and we've looked into different routes where we might be able to kind of improve our skills for our service and look for slightly different training. So we have the standard ones that we do and we repeat, and we've been doing online and the last 12 months, and also different courses which have been a bit more kind of person-based, where we've been able to all get as a group and also talk about our activities and how might we use this training within our service, and really kind of get our hands dirty, if you see what I mean.
Yeah, and I know you've talked a bit about your training, Jane, but is there any like specific points as well you want to mention on? Oh, I think you're still on mute. It's all right.
Yeah. I think I need training on this, really, don't you? That's my next step of training. Yeah, I think that just from a personal point of view, I think that within the care profession, that's the word you've got to have first. You've got to care about what you do. And the qualifications for me, yes, are necessary for us to develop and support people in a person-centered way. But I genuinely feel that with a lot of people, the things like the MVQ progression and stuff like that is so useful, because you're working in such a person-centered way that you're being assessed continually. And if you're doing the right thing, then obviously you'll get the qualification. I mean, some people choose to go down the route of college or nursing or sort of academic qualifications. That's brilliant if you're made in that way. Personally, I wasn't. I felt that I was better learning on the job and progressing as I went along, and having opportunities where people say, like Jonathan said, this course is available, that's available, or this week we're going to learn how to do Makaton, or we're going to learn how to do BSL, or we're learning more about dementia. So whatever was on offer, I feel that I'm lucky I've got a staff team that if they're interested in it, we can usually get some training on it, and then that helps us to develop the service and work with the individuals that we support.
It's nice to hear that the progression is kind of part of the career as well, and that you're happy doing it all, and it's really lovely to hear that, really. So I suppose we've got a nice question next. So it'll be like, can you tell us your proudest career moments? So Jane, do you want to go first for that one?
Oh, that's quite a difficult one, really. Mainly, I've got a few, but I'll not bore you with all of them. It's down to supporting individuals who I know I made a difference with. Way back in my early days, working with adults with physical disabilities, I worked with someone who really struggled to communicate with others, and his mum asked me to support him on a one-to-one basis, and I did that for a long time. And I'd say that his goal and the family's goal was to go on holiday with him, because he really struggled with lots of the things in the outside world. And eventually, after a lot of years, and it was years, the family managed to get him on a plane and he went to Disney World. So for me, that was a really proud moment, because they actually asked me to go with them as well to support them while they were there, which was amazing. So that's a proud moment with it in career. And the other one was, I call it my door handle moment, was this has happened a couple of times now, and I think it's about asking the right questions and really find out in a person-centered way what matters to somebody when they're coming into a service as an older adult. And we have support plans, and we have all the right things in place to get to know people's illnesses and if they've got any memory difficulties and all those kinds of things. But it's really important to get to know the person, and this is why I call it the door handle moment, because you can ask all the questions, and the last question I ask is there anything actually about you, anything important that we need to know, any achievements, anything that you want to share with us? And very often people shake their head and go, no, there's nothing, I've not done anything. And they get to the door and they turn around, and I've had a few of these where one person said to me, I did walk across Poland to try and escape the Germans. And I'm like, come back in. We need to talk about this and get to know more about this. And I think they're the proud moments when you've asked the right question, that somebody feels comfortable enough to actually talk to you and share things that are really important to them. They're the proud moments.
That's really lovely to hear them as well. And Jonathan, do you have any career moments you want to tell us about?
Like Jane said, I think within my role, every day you kind of look for that moment every day, and I think every day you can often find something that you think really enjoyed that about. Like Jane said, someone telling you something that you didn't know about them, and you may be someone may struggle with the verbal communications or things like that, but every so often you'll get something and you can really work on that thing. And I think there's a lot of things in the past where you kind of, like Jane said, you get that eureka moment where you kind of learn that someone loves this or wants to do that, and then you can enjoy that with them. And I've taken many like little short walks where I used to have a group of gents. We used to go out, just about 4 of them and me, and just on the little walks we find out so much about each other that you would never know, and then you can bring back into the service. So I think that's one of my proudest things, is just every day you learn something new. There was also another one in a role I worked previously. I was a lady, and we were trying to help her kind of learn different skills, because she didn't have very good with skills within English, and I recognized with her, because I was trying to teach her the letters, but she didn't know the alphabet song. If you know A, B, C, like we all would know the pattern of the song, so she didn't know where the order of the letters were in the alphabet. So when I worked out, she doesn't know this song, she's never been taught this song. And once she learned the song, we were able to place the letters easier. And from there, she really got a more handle on letters.
That's a really lovely story as well, because I mean, all of them are really lovely, from the Disney one to the letters one. It seems like such a great career to work in, especially if you're passionate about it. So trying to follow on and from those kind of emotional questions there. So for you, Jonathan, as a charity, do you have any volunteers working with you, and how do they make up part of your team?
The really sad thing is the last 12 months, we've not been able to have any volunteers in. And we've got some fantastic volunteers that often will ring us up or send messages and say, oh, when can we come back? And it's so difficult to try and get them back. Unfortunately, a lot worked in our kitchen, but because we've been moved from the Tontine Road base that we were in to the Arkwright Centre, we're not in charge of food anymore. So we don't do our own things. So a lot of our volunteers, we're still waiting to bring back, and a lot of them are in the wings. But we've got some fabulous volunteers that come to us multiple days and really enjoy it and really make it part of like a community feel. And the service users will know the volunteers, and they will know. And we have very able ones that help us almost at a staff level, all the way through to people who might just enjoy one task, but it all helps so importantly. And knowing, as being a volunteer myself, I see the importance of just maybe the pot washer. That's not the most glamorous job, but it's such an important job as part of the day, because it allows everyone else to do a different job. So unfortunately, we've not been able to see many of our volunteers for over a year now, but we know they are there waiting, and some of them are so keen to come back, and it'll be a lovely day when we can finally welcome them all back to our service.
What about you, Jane? Do you have any volunteers you work with or anything like that?
It's the same as Jonathan, really. My role's slightly different because all of the board of trustees that I'm answerable to are all volunteers. So these may be people who've worked in adult social care, or some have worked in finance and they're interested in how the charity works and how it runs, and they help with that kind of input. So Jonathan's absolutely right. We have some fantastic volunteers, and we also have people who have been long-term volunteers, and I feel that it's a two-way street with the volunteers. Yes, they support us, but we often support them as well, because I feel that, and again from a personal experience, I knew when I was 17, 18, which is a long time ago, but volunteering was so important to me, and it helped me to know where I wanted to be in the world, and it also gave me some boundaries, and I think that it kind of teaches the adult world of work, but in a safe way, because you've got people who can say to you and guide you and help you and be there, and you're volunteering your time, so it's a win-win situation, really. But yeah, so it's two levels of volunteer at Chesterfield Care Group, so it's quite varied and different.
It sounds like you've got a great supportive network of volunteers there, and so they all make a difference. Like you said, even the pot washing, Jonathan, it does make a difference. So I suppose the last question, so what would the next steps be for someone watching this event who might be interesting or considering this as a career? So Jonathan, do you have anything to say on that?
I guess from my point of view, as someone who went in as a volunteer, I did a placement. It's always good. You can find out what you really want to do. And obviously, with there being a lot of different roles within care, you can try different things. You maybe could come and volunteer with somewhere like us, like a day centre or a care home or different things like that, where you might think, oh, I really enjoy this. This is what I enjoy, and then progress from there. But obviously, there's other academic ways. And once you're in somewhere, you might be able to think, well, I want to do an MVQ, like Jane mentioned earlier, on this subject, on this thing or that thing. So I found volunteering was really helpful for me to kind of find out what I wanted to do, and then look for the qualifications to go into the role that I wanted to do.
It's nice to hear that link between the volunteering and the career steps as well, as it all play a part. Jane, do you know anything else or have any advice for people that are considering it as a career?
Again, the main thing is enjoy what you do. And if you want a career in care, then I think there's nothing better. You're around people, you feel you make a difference. You usually work in a great team, which we do, which is always a benefit. But there's so many varied things. One day is never the same. You can turn up one day and somebody's had a fantastic weekend and they're telling you all about it. And then another day, they might not have had such a good time. And so you're listening and you're learning about that person, and you're trying to figure things out, because sometimes people don't always say what they feel. They might skirt around the edges. So there's all sorts of different things you can do. So I know, again, a long time ago, one of the first things I did, I went to a listening skills course. because if you can actually actively listen to somebody, then you can actually find out what they really want from the service you're providing. Yes, there's all the activities and the things around that, but and there's lots of skills you can learn. But I think the biggest thing is to actually really listen to what people want from the service, and listen to your colleagues as well, because once you find out really what's underneath and what's going on, you can provide a better service and you can learn from each other. So that's the biggest thing, is enjoy learning, enjoy what you're doing. And yes, there's official qualifications, and they're brilliant, and you need those to be in care. But I'd say the first step is enjoy what you're doing, focus on that first, and then look at the qualification side and see how you can progress into a career if that's what you want.
Yes, that sounds really good advice. I mean, enjoying what you're doing. So I hope people take that as if they're looking for a job in care. So thank you both for coming along to this session. You've both been great in answering all my questions. So yeah, I'll just thank you, and then I'll pass you back on to kind of end the session. But you've both been great, so thank you.